Hello, and welcome to my chiropractic clinic. My name is Dr. David Heller, and today I'm going to be discussing cervicogenic headaches, the risks, benefits, and effects of chiropractic care on them, and consider this as an informed consent video to help you make an educated decision about your care. So first thing is that cervicogenic headaches are classified as neck pain and headache pain occurring at the same time. Now, they don't have to happen immediately together, but typically people will either have neck pain and then follow up with a headache, or they'll have a headache that is followed by neck pain. Either one counts as cervicogenic headaches and can benefit from chiropractic care. So some of the benefits of chiropractic care on these types of headaches is that we can expect to see, for most people, an immediate relief in pain, immediate improvement in range of motion, and a continuing discovery that their headaches are now occurring less frequently and they're less intense. Now, some risks for care is that, number one, that you might find your headaches duration and frequency slightly increase, as well as your neck feels a little bit more stiff and a little bit more painful. Now, this is less likely than the benefits, but it is possible, and this might last up to a week. And this is because some people are more used to the patterns that they had related to that cervicogenic headache, and it might take them a little bit longer for their body to get used to the adjustment made. And in that process, their symptoms might just get a little bit worse before they start to feel it gets better. Now, one of the more serious risks associated with an adjustment on cervicogenic headaches is that sometimes there's actually an underlying stroke happening. Chiropractic care has been found through medical science to only cause strokes at less than 1 in a million chance. So the chances are very low that the adjustment itself causes a stroke. And in most cases, what ends up happening is that patients present to the clinic having already experienced a stroke they just don't know of yet, because strokes can occur with early detection or late detection. Now, late detection is really obvious. There are very obvious signs of loss of function and ability to move their body. Early detection, stroke looks like a cervicogenic headache. There's neck pain and there's a headache happening at the same time. And so one of the things that we're going to do is, after the adjustment, especially early on in care, is we're going to adjust you, and we're going to have you sit down and rest for up to 15 minutes to make sure that your symptoms don't get much worse or that you don't experience new symptoms. So it's important to understand that for people who are just getting used to an adjustment and it takes them a little longer, it's only a slight increase in pain, a slight increase in headache intensity and duration and frequency, whereas people who are experiencing a stroke will have a sudden increase of a large amount of pain and headaches, and they might have new symptoms and loss of function associated with that very quickly. So most people experience the benefits of the effects, and those effects are felt immediately. There tends to be an improved range of motion, there tends to be improved mood, and an overall sense of greater well-being. And so in order to make this process and inform you of this process as thoroughly as possible, we're going to start by beginning with a physical examination. This is just going to help us to rule out any other contraindications or to be aware of any other complications that you might have going on that you didn't tell us about at the clinic. And this will allow you the opportunity to learn and ask any questions throughout the process along the way, which we do encourage you to do, because what I find important is that you and I are both on the same page and that you can make informed decisions and ask informed questions moving forward. Thank you.